Over 1,000 employees across the Department of Health and Human Services were notified late Friday that they'd lost their jobs. But then many of those fired began receiving suddenly these emails that were communicating that despite the earlier notice, they would no longer be let go. Confusing, right? Well, there's more to it. An HHS official also told MSNBC that around half of the firings were done in error. Vice President J.D. Vance was asked about the firings today, and one word kept coming up repeatedly about the fallout from the government. Shutdown. Watch this.
The government shutdown inevitably leads to some chaos. We are figuring out how to take money from some areas and give it to other areas. That chaos is because Schumer and the far left Democrats shut down the government. That is going to lead to some chaos. In that moving things around, there is some chaos, but there's going to be chaos. We're dealing with a terrible, chaotic situation.
Joining us now to discuss is Dr. Vin Gupta, MSNBC medical contributor, pulmonologist, and former consultant for the World Bank Pandemic Emergency Financing Facility. Dr. Gupta, thanks so much for being here. First of all, what's your response to this so-called chaos that the vice president keeps talking about, right? What do you think about that? What do you think about the layoffs from HHS and everything that we're about to continue to expect?
Well, good evening. First off, I should say that this is having an impact. Whether these layoffs are rescinded or not, I think everybody needs to know that there's been a reduction in force in the CDC and across HHS that it happened over the last few months. And so a lot of people have lost their jobs, almost over 10% of the workforce. This is additional injury on top. So even if these people are being given back their jobs, half of them, what happens to just from a morale standpoint? I'm in touch with several of them. It's not like they feel they have security in their jobs, and they're already doing a public service for the country at a significant discount. These are individuals highly trained that could get paid a lot more money in different parts of the healthcare sector. And so who's going to want to stay when you don't know if you're going to be guaranteed the next paycheck, or if this is just going to keep happening again because of politics? So that's one. Two, I'll just say they are playing with fire with critical parts of the CDC that look at emerging pathogens, the next Ebola as an example. And here's why it matters. This information is communicated by the CDC under normal Democratic and Republican administrations to local and state departments of health that then ultimately communicate to those of us caring for patients in ERs and ICUs across the country. Here's why it matters. It helps us understand what's happening with the patient in front of us. And so if we don't have those data inputs from the CDC, they don't come to us clinicians forming differential diagnoses, people will be harmed, and that's what's happening.
Dr. Gupta, I wanted to get your thoughts, if you can, and reflect here for a moment on the loss of confidence in the CDC as a trusted scientific data-based institution that many Americans, I would argue, maybe 10 years ago really had a lot of confidence in, but over the course of the last several years has been politicized, and now, as we've seen, has been decimated as a result of the actions by right-wingers in this country who have kind of denounced the CDC during the COVID era, and now, as you see, being gutted and losing some of its top scientists and data-driven analysts.
Amen. I would say that there's a very vocal, small minority of people, less than 20% based on polling, that don't believe what's coming out of the CDC. 82% of Americans believe in the childhood vaccine schedule that the CDC typically has endorsed. There's something that they just reduced a reduction in force. The editors of the Morbidity and Mortality Weekly Report, and then had to reverse it because supposedly this chaos that the vice president references, they didn't understand what they were cutting. So a lot of what's happening here is they don't understand what they're cutting because the whole thing's been politicized. But MMWR, Morbidity and Mortality Weekly Report, just to give your viewers a sense here of what's happening, that is as esoteric and as nuanced clinical information for those of us caring for patients that exists. Number one. Number two, it's critical to actually understand, how do you understand what's happening with the patient in front of you that might be experiencing something novel or something new. This is what they're actually harming here. And again, 82% of Americans, several surveys have shown, support the CDC in its prior incarnation, and they don't want this.
Dr. Gupta, can I ask you really quickly, in our colleagues' reporting, a former director at the CDC is quoted saying the CDC is over, it was killed, this administration only knows how to break things, they have made America at risk for outbreaks and attacks by nefarious players. People should be scared. Can I ask you quickly, do you agree with that? Do you think people should be frightened right now?
They should. I know that, I know Dr. Daskalakis quite well, and I agree with him, the former head of the Center for Immunizations and Respiratory Diseases. We are entering cold and flu season, and we have a CDC that has no steward here to help guide us if something untoward or unexpected happens. And that's, unfortunately, the playbook here. Something always unexpected can happen in public health, and we have nobody to help guide us.
Yeah, I was going to say it's one more reason that states have to step up really and provide more information for their residents, because the federal government right now is it's a mess. Dr. Vin Gupta, it's great to see you. Thank you, as always, for joining us.